I am Dr. Laura Moreno, and in this video, I want to talk to you about prostate problems, and more specifically, about those early symptoms that many men ignore for years without realizing that their body has already been trying to warn them. The prostate is a small gland, but its role in the male body is significant. What makes prostate problems tricky is that they rarely announce themselves loudly at the beginning. There is usually no sharp pain, no dramatic crisis, no single moment that forces immediate attention. Instead, the body starts to change subtly, quietly, and those changes are often easy to dismiss. Many men assume that prostate issues only appear at an advanced age, and that belief alone delays awareness. The reality is that while some conditions are more common later in life, prostate-related symptoms can begin much earlier, and when they do, they often present in ways that don't seem serious enough to worry about. One of the first areas where changes appear is urination. This doesn't always mean pain or burning. Sometimes it's just that urinating no longer feels the same. The stream may feel weaker than before, or it may take a few seconds longer to start. At first, this is barely noticeable, and most men adapt without thinking much of it. Another early sign is the need to urinate more frequently, especially at night. Waking up once during the night to go to the bathroom is often brushed off as normal. Then it becomes twice, then 3 times. Because this progression is gradual, it's rarely seen as a warning sign. Sleep becomes fragmented, but the connection to prostate health is not always made. There is also the sensation of urgency, the feeling that when the urge to urinate appears, it comes suddenly and intensely. This can lead to anxiety about being far from a bathroom, planning outings around restroom availability, or avoiding long trips. These behavioral changes often happen unconsciously. Some men notice a feeling of incomplete emptying after urination. They finish, but it doesn't feel finished. There's a lingering sensation that something remains. This can lead to repeated trips to the bathroom within a short period of time. Again, this symptom alone may not seem alarming, but it's part of a larger pattern. Discomfort in the pelvic area is another symptom that is commonly ignored. This is not usually sharp pain. It may feel like pressure, heaviness, or a vague ache in the lower abdomen, perineum, or lower back. Because it's not clearly localized, it's often attributed to muscle tension, prolonged sitting, or physical activity. Sitting for long periods can become uncomfortable without an obvious reason. Some men notice that driving, working at a desk, or sitting through meetings causes discomfort that eases when standing or walking. This symptom is frequently overlooked or misattributed to posture issues. Sexual changes can also be early indicators. These changes are not always discussed openly, which contributes to their being ignored. A decrease in the force of ejaculation, changes in sensation, or discomfort after ejaculation may appear gradually. Because these changes are subtle and not always consistent, they're easy to rationalize away. In some cases, there may be mild burning or irritation that comes and goes. It's not intense enough to feel like a classic urinary tract infection, and it may not show up clearly on basic tests. This inconsistency can be confusing and lead to frustration. The prostate is closely connected to the urinary system, the nervous system, and the pelvic muscles. When something begins to change in one area, the body often compensates in others. This compensation is why early symptoms can be masked for so long. Stress plays an important role here. Chronic stress affects muscle tension, nerve signaling, and hormonal balance. In men who are already predisposed, stress can worsen urinary symptoms, increase urgency, and intensify discomfort. This does not mean the problem is psychological, but rather that the body responds as an integrated system. Another factor that complicates early recognition is bowel health. Constipation and prostate symptoms often influence each other. Chronic constipation can increase pressure in the pelvic area and worsen urinary symptoms, while prostate issues can make bowel movements more uncomfortable. This connection is rarely discussed. Many men delay seeking medical advice because the symptoms don't feel severe enough. Others avoid it out of fear of invasive tests or uncomfortable conversations. Some simply normalize the changes, believing that this is just what happens with age. Self-medication is another common issue. Taking antibiotics without proper evaluation, using supplements without guidance, or trying to manage symptoms alone can delay accurate diagnosis and appropriate care. It can also blur the clinical picture, making it harder to understand what is actually happening. It's important to understand that early prostate symptoms do not automatically mean a serious condition. Many prostate issues are manageable, especially when addressed early. But ignoring symptoms doesn't make them disappear. It only allows them to progress silently. The body rarely sends a single signal in isolation. It communicates through patterns. When urinary changes, pelvic discomfort, sleep disruption, and sexual changes begin to overlap, the body is asking to be listened to. Men often adapt their lives around these symptoms without realizing it. Limiting fluid intake, avoiding social situations, planning routes based on restroom availability, or accepting poor sleep as normal are all signs that quality of life is being affected. Awareness is the first step. Not panic, not fear, but awareness. Understanding that subtle changes matter allows for informed decisions instead of delayed reactions. Listening to the body early opens the door to simpler, more effective interventions. There is still much to explore about how these symptoms evolve, how to distinguish between temporary changes and persistent patterns, and when it becomes important to take the next step rather than waiting longer. And that's something we need to continue talking about carefully and in depth, because those early patterns don't stay static. What starts as a mild inconvenience often evolves slowly, and that slow progression is exactly what makes it dangerous to ignore. As time goes on, the bladder has to work harder to push urine past a prostate that is no longer functioning optimally. This increased effort can lead to bladder muscle fatigue. When that happens, symptoms may shift. Some men notice that instead of urgency, they begin to experience hesitation. They stand at the toilet waiting for the stream to start, sometimes feeling tense or frustrated, even when the urge is strong. Dribbling after urination is another sign that often appears quietly. The person thinks they're finished, but moments later, there's leakage. This can feel embarrassing and is often managed by behavioral adjustments rather than addressing the root cause. Extra time in the bathroom, specific movements, or excessive wiping become routine without much thought. Nighttime symptoms deserve special attention. Interrupted sleep is not just an inconvenience. Waking multiple times each night affects concentration, mood, metabolism, and overall health. Many men don't connect chronic fatigue or irritability with prostate-related sleep disruption, but the link is very real. There can also be changes in how the bladder signals fullness. Some men lose the gradual warning and instead feel a sudden, intense need to urinate. This can create anxiety, especially in public or professional settings, leading to constant mental scanning for bathrooms. Pelvic discomfort may become more noticeable over time. What was once a vague pressure can turn into a dull ache that comes and goes. It might worsen after sitting, after ejaculation, or during periods of stress. Because it's inconsistent, it's still easy to dismiss, but inconsistency doesn't mean insignificance. In inflammatory conditions of the prostate, symptoms can fluctuate dramatically. A man may feel almost normal for weeks, then suddenly experience a flare of discomfort, urinary changes, or sexual symptoms. When things improve again, the problem is assumed to be gone, even though it's still present beneath the surface. Emotional responses also begin to appear. Frustration, irritability, and even low mood can develop, especially when symptoms interfere with sleep, work, or intimacy. These emotional effects are often treated separately, without recognizing their physical trigger. Sexual confidence can be affected long before erectile problems appear. Worry about discomfort, changes in sensation, or performance can lead to avoidance. Because these changes happen gradually, they may not be recognized as part of a health issue, but rather as personal or relational problems. Another overlooked aspect is hydration behavior. Many men start drinking less water to avoid frequent urination. While this seems logical, it can actually irritate the bladder further and concentrate urine, worsening symptoms. This cycle reinforces discomfort and confusion. Diet can also influence symptoms. Spicy foods, alcohol, caffeine, and highly processed foods can irritate the urinary tract in some men. When symptoms are mild, these triggers may not be obvious. Over time, sensitivity can increase, making reactions stronger and more frequent. Physical activity plays a dual role. Moderate movement often improves symptoms by reducing pelvic tension and supporting circulation. On the other hand, prolonged cycling or activities that place pressure on the perineal area may worsen discomfort in susceptible individuals. Without guidance, it's hard to know what helps and what harms. The prostate doesn't exist in isolation. Hormonal balance, particularly involving testosterone and its metabolites, influences prostate tissue. Changes in hormone levels over time can subtly affect prostate size and sensitivity, contributing to symptom development long before any diagnosis is made. Family history is another factor many men are unaware of or underestimate. A history of prostate conditions in close relatives can increase risk, but without symptoms that feel serious, this information is rarely acted upon early. One of the biggest challenges is the cultural silence around prostate health. Many men are never taught what normal prostate function feels like, so they have no reference point for change. Without that baseline, early symptoms blend into everyday life. Medical evaluation in early stages is often simpler than expected. It usually begins with conversation, observation, and basic assessments. But fear of the unknown keeps many men away until symptoms become disruptive. Understanding that early prostate symptoms are messages, not verdicts, changes the entire perspective. They are not signs of failure or weakness, they are information, and information gives options. There is still an important distinction to be made between temporary irritation and persistent dysfunction, between symptoms that resolve on their own and those that signal a deeper imbalance, and recognizing that difference is something we need to continue unpacking carefully, because learning to recognize that distinction can prevent years of unnecessary discomfort and uncertainty. Temporary irritation of the prostate or urinary tract can happen for many reasons. Dehydration, short-term stress, dietary triggers, or even prolonged sitting can cause symptoms that resolve once the trigger is removed. The problem arises when those same symptoms keep returning, even when conditions change. Recurrence is one of the clearest signs that something deeper is going on. Patterns matter more than intensity. A mild symptom that appears consistently over months is often more significant than a strong symptom that happens once. The body tends to whisper before it shouts, and prostate-related issues are a clear example of that. Another subtle sign many men ignore is a change in how the bladder feels after urination. Not just the sensation of incomplete emptying, but a lingering awareness of the bladder area. It's as if the body remains focused on that region longer than it used to. This heightened awareness often reflects irritation or altered nerve signaling. The nervous system plays a major role in prostate symptoms. The prostate is rich in nerve connections, and when those nerves become sensitized, even normal sensations can feel uncomfortable. This is why some men experience symptoms without clear findings on imaging or lab tests. The absence of obvious abnormalities doesn't mean the symptoms aren't real. Inflammation can exist at a microscopic level. It doesn't always show up as dramatic swelling or infection. Low-grade inflammation can alter tissue behavior, muscle coordination, and nerve responses, leading to chronic symptoms that feel vague but persistent. Pelvic floor muscle tension is another overlooked contributor. Stress, anxiety, and habitual muscle tightening can cause these muscles to remain in a contracted state. This tension can affect urinary flow, increase urgency, and cause discomfort that mimics prostate problems or worsens existing ones. In these cases, the prostate becomes part of a larger pelvic imbalance rather than the sole problem. Treating only one piece without addressing the system often leads to partial relief at best. Sleep deprivation further amplifies symptoms. Poor sleep increases pain sensitivity, disrupts hormone regulation, and weakens stress resilience. When nighttime urination interrupts sleep repeatedly, it creates a feedback loop that intensifies symptoms during the day. Mental focus on symptoms also changes perception. When urination becomes something to monitor constantly, every sensation feels louder. This doesn't mean the symptoms are imagined, but it does mean that attention can amplify discomfort. Breaking this cycle often requires addressing both physical and behavioral factors. Many men delay evaluation because they're waiting for a clear sign that something is seriously wrong. Unfortunately, by the time that sign appears, the condition may be more complex to manage. Early evaluation is not about labeling, but about understanding. Age-related changes in the prostate are common, but common does not mean insignificant. Just because many men experience similar symptoms doesn't mean they should be ignored. Normal aging still deserves care and support. Fluid timing also becomes important. Drinking large amounts of liquid late in the evening can worsen nighttime symptoms, while spacing fluids throughout the day can reduce bladder stress. Small adjustments can make noticeable differences when guided appropriately. There is also a psychological barrier related to masculinity and vulnerability. Many men feel uncomfortable discussing urinary or sexual symptoms, even with healthcare professionals. This silence often prolongs suffering more than the condition itself. Early conversations about prostate health can reframe the experience. Instead of fear-based thinking, men can approach it as maintenance, similar to caring for any other part of the body. This shift alone reduces anxiety and improves outcomes. When symptoms are acknowledged early, interventions are often simpler. Lifestyle changes, targeted exercises, stress management, and monitoring may be enough to stabilize or improve the situation. Waiting often narrows those options. The prostate responds to cumulative habits over time. Movement, diet, stress levels, sleep, and hydration all play a role. Symptoms don't appear randomly, they reflect an imbalance that has been building. Understanding that buildup, learning to read the early signals, and recognizing when normal has slowly shifted into persistent is key. And there is still more to unpack about how these signals evolve and when they require deeper attention, because there comes a point where continuing to ignore those signals no longer protects you. It only prolongs uncertainty. Prostate symptoms don't suddenly become important the day they are diagnosed. They become important the moment they begin to change your routines, your sleep, your comfort, or your confidence. The body doesn't wait for permission to adapt, and over time it builds workarounds that mask the problem instead of resolving it. Listening early doesn't mean assuming the worst. It means giving yourself the chance to understand what your body is communicating before discomfort becomes limitation. The prostate sends information quietly, through patterns, repetitions, and small shifts that only make sense when you step back and look at them together. Taking those signs seriously is not about fear, and it's not about age. It's about awareness and responsibility toward your own well-being. The earlier those conversations begin, the more options remain on the table, and the less disruptive the process tends to be. Your body is constantly working to maintain balance. When it starts asking for attention, responding with curiosity instead of avoidance can make all the difference.